Hello, my name is Christopher South, and this is another exciting episode of the Easy EMT. And today we're going to be starting a series about mental health. And what I want to start out with first is to go right into a presentation about bipolar disorder. All right, guys, so let's start going right into our presentation about bipolar disorder. And hopefully, we're going to be able to dispel some pretty terrible stigma that surrounds bipolar disorder and give you some facts and information that's really going to help you and to be a better practitioner, but also to understand what quite a few million Americans, including myself, suffer with. So, what is bipolar disorder? So, bipolar disorder, let's go back, formerly called manic depressive illness or manic depression, is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day to day tasks. There are three types of bipolar disorder. All three types involve a clear change in mood, energy, and activity levels. These moods range from periods of extremely up, elated, irritable, or energized behavior known as manic episodes to very down, sad, indifferent, or hopeless periods known as depressive episodes. Less severe manic periods are known as hypomanic episodes or hypomania. So, with type 1 bipolar disorder, this is clearly defined by uh, episodes that last at least 7 days or by manic symptoms that are so severe that the person needs immediate hospital care. Usually, depressive episodes occur as well, typically lasting at least 2 weeks. Episodes of depression with mixed features, having depressive symptoms and manic symptoms at the same time, are also possible. So, they can have a variety of symptoms there. Well, bipolar 2, which is the one that I'm currently diagnosed with, is defined by a pattern of depressive episodes and hypomanic episodes, but not the full blown manic episodes that are typical of bipolar 1 disorder. Cyclothymic disorder, also known as cyclothymia, defined by periods of hypomanic symptoms as well as periods of depressive symptoms lasting for 2 years, 1 year in children and adolescents. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. So the onset is typically diagnosed in early adulthood. Bipolar disorder is typically during late adolescent or the teen years or early adulthood. I started having progressive symptoms later on in my early 20s, and it got worse until I was officially diagnosed when I was after I was 30 years old. Occasionally, bipolar symptoms can appear in children. Bipolar disorder can also appear during a woman's pregnancy or immediately following childbirth. Although the symptoms may vary over time, bipolar disorder usually requires lifelong treatment. So, what are some of the causes of bipolar disorder? Well, this is where it gets kind of strange. So, definitely more research is needed. The exact cause of the disorder is unknown. Experts do believe that there are a number of factors that work together to make a person more likely to develop it. These are thought to be a complex mix of physical, environmental, and social factors. And this is what they know so far. So they believe that bipolar disorder is believed to be the result of chemical imbalances in the brain. This is why they give you medication. The chemicals responsible for controlling the brain's function are also called neurotransmitters. So neurotransmitters kind of form kind of like wires in your brain. And so the chemicals responsible for controlling the brain's functions are including noradrenaline, serotonin, and dopamine. There's some evidence if there is an imbalance of one or more of the levels, the person may develop symptoms of bipolar. For example, there's evidence that episodes of mania may occur when levels of noradrenaline are too high, and episodes of depression may be the result of noradrenaline being too low. Genetics. And one of the things I love is this picture right over here. It says, why can't you control yourself and try to act like a normal person? Is because the brain is not functioning as it needs to. It's definitely an illness. This is not a behavior disorder. It is thought that bipolar disorder is linked to genetics as it seems to run in families. My mother was thought to have had bipolar disorder. The family members of a person with bipolar disorder have an increased risk of developing it themselves, but no single gene so far is responsible for it. Instead, a number of genetic and environmental factors are thought to act as triggers for the symptoms of the disease. So, some of the triggers um, that can cause us, and this is definitely not an exhaustive list of some of these triggers. Triggers can be the breakdown of a relationship, physical, sexual, or emotional abuse, the death of a close family member or a loved one. These types of life-altering events can cause episodes of depression at any time in any person's life, but more pronounced in somebody with bipolar. Bipolar disorder may be triggered by a physical illness, sleep disturbances, everyday problems in everyday life, such as problems with money, work, or relationships. Mine is typically got to visit with a good friend of mine who's a mental health care nurse, and I started writing down when I would have terrible episodes and some of the things that would trigger them. And so for me personally, one of my patterns that I have, and I'm not real proud to talk about it, but it's something I think is going to help others, is the fact that during one of the things that happens to me is I become manic and I take on lots and lots of projects, especially at work. I get overwhelmed by those projects and can't keep up with them. And by that time, that manic where I took on the project has led over into depression, and I become very irritable and everything, and it causes problems at work, and it just leads to one thing after the other. And so there's definitely lots of different triggers, but also I've also noticed that after I become ill, I typically have very severe bipolar symptoms. I just got over COVID-19, and that was not a very pretty thing for me. But anytime that I've had illnesses in my life, it's usually followed by some kind of bipolar episode. So here are some of the main symptoms. It is a mood disorder, and that's why it's so hard for people to understand and be like, why can't you just be happy? Or why can't you be more pleasant? Or can you change your attitude? And the answer simply is, I'm trying. I wish I could change these things over and not have those severe symptoms. So people with bipolar disorder experience periods of unusually intense emotion, changes in sleep patterns and activity levels, and uncharacteristic behaviors, often without recognizing their likely harmful or undesirable effects. These distinct periods are called mood episodes. Mood episodes are very different from the moods and behaviors that are typical for that person. I want to repeat that again. Mood episodes are very different from the moods and behaviors that are typical for that person. I can be very pleasant and upbeat, but when I'm having these episodes, it's completely out of the normal for me. It's definitely outside of how I normally am, and I'm completely different. Um, Moods, and so during an episode, the symptoms can last every day for most of the day. Episodes may also last for longer periods, such as several days or weeks, and for some folks, even months. So let's take a look between the difference between having a manic episode versus a depressive episode. So with a manic episode, you can have feelings of overly happy for long periods of time. They're very upbeat. And for a lot of times during that period, people like to be around them. They're very spontaneous, they're very outgoing, upbeat. They may be very generous during this time. They can talk very fast with racing thoughts, going from one thing to the next. They become very easily distracted, having overconfidence in abilities, and engaging in risky behaviors such as spending too much money, which is one of the big things that a lot of bipolar patients have is they overspend, they can't save, they have a lot of financial problems. Engaging in risky activities such as hypersexuality with different partners, engaging in lots of drugs and alcohol. Bipolar depression is feeling sad or hopeless for long periods of time. Significant changes in appetite. Usually when I'm depressive or anything, I either eat too much or I don't eat at all, and it definitely causes trouble with my diabetes as well. Think about or attempting suicide, feeling fatigue or lack of energy. One of the things that you can usually tell when I'm depressed is I'll complain about being tired a lot of times. problems with memory and concentration, and that can cause some problems as well, especially for folks who have bipolar and they're working and everything, is even during the depressive thing is because their brain isn't functioning the way it needs to. They may not remember things. Um, they may lose trouble, have focus issues, and that kind of stuff as well. So let's take a look at the two poles here. The highs. When a person is manic, they can be overexcitement, restless. They can have that high sex drive, be more impulsive, make unrealistic plans, become more impulsive. Drug and alcohol abuse is more likely in the high portion, and poor concentration. The lows, sadness, insomnia, thoughts of suicide or even an attempt, uncontrollable crying, changes in appetite, loss of energy, trouble concentrating, and trouble making decisions. So let's take a look at the diagnosis. And we're going to talk a little bit about diagnosis from not so much from an EMS standpoint at this point. So proper diagnosis and treatment can help people with bipolar disorder lead healthy and active lives. Talking with a doctor or other licensed healthcare provider is the first step. The healthcare provider can complete a physical exam and order necessary medical tests to rule out other conditions. We're going to talk about this in just a second. The healthcare provider may then conduct a mental health evaluation or provide a referral to a trained mental health care provider, such as a psychiatrist, psychologist, or clinical social worker who has experience in diagnosing and treating bipolar. Mental health care providers usually diagnose bipolar based on a person's symptoms, lifetime history, experiences, in some case, family history as well. An accurate diagnosis in youth is particularly important. Us as EMS providers, we don't provide a diagnosis with any mental health condition because there's so many different other medical issues that can cause some of the same issues associated with. A person could be having seizures and have these symptoms. A person could be having a stroke. They could have hyper or hypoglycemia that can cause these, all kinds of different things. Brain function, brain disorders, the different things that can happen. So let's make sure that we're rolling out all the medical things first. So complications to the illness. So it can be difficult to diagnose. Some bipolar disorder symptoms are similar to those, just like we talked about, of other illnesses, which can make it challenging for a healthcare provider to make a diagnosis. In addition, many people have a bipolar disorder along with other mental disorders or conditions, such as anxiety disorder, substance abuse, or an eating disorder. People with bipolar disorder have an increased chance of having thyroid disease, migraine headaches, heart disease, diabetes, obesity, and other physical illnesses as well. So psychosis. Sometimes a person with severe episodes of mania or depression may experience psychotic symptoms such as hallucinations or delusions. The psychotic symptoms tends to match the person's extreme moods. During a manic episode, they may have unrealistic beliefs. They are famous, have a lot of money, or even have special powers. During depressive episodes, they may believe that they are financially ruined and penniless, have committed a crime, or have an unrecognized serious illness. People with bipolar disorder who have psychotic symptoms are sometimes incorrectly diagnosed with schizophrenia. When people have symptoms of bipolar disorder and experience periods of psychosis, they are separate from mood episodes. The appropriate diagnosis may be schizoaffective disorder. It is quite common for folks with bipolar disorder to also have anxiety, as well as ADHD. People with bipolar disorder may misuse alcohol or drugs and engage in other high-risk behaviors at times of impairment. During manic episodes, although the negative effects of alcohol use or drug use may be most evident to family, friends, or healthcare providers, it's important to recognize the presence of an associated mental disorder. In some cases, people with bipolar disorder also have an eating disorder, such as binge eating or bulimia. I do binge eat during when I'm having an episode where it's depressive or a manic episode. So social complications, this is a huge one. This is the one that most of us are pretty familiar with. So the bipolar disorder can impact families in the following ways. There can be emotional distress, such as guilt, grief, and worry. Disruption in regular routines, having to deal with unusual or dangerous behavior, financial stresses as a result of reduced income or excessive spending, strained marital or family relationships, changes in family roles, difficulty in maintaining relationships outside the family, health problems as a result of stress. And here in just a few minutes, I'm actually going to go really into detail what it's like to live with bipolar disorder, and hopefully you'll gain some understanding through that. Difficulty with work. Bipolar disorder and other mental health conditions have the potential to make it difficult for a person to find and keep a job or function at work, especially if symptoms are currently affecting day-to-day functioning. In one survey, 88% of people with bipolar disorder or depression said their condition has affected their work performance, and about 58% of them quit working outside the home altogether. There are many challenges related to having bipolar disorder and keeping a job. However, experts say that work can actually be quite helpful to the people with bipolar disorder. And this is going to work out really well is if employers and the patient themselves come to an agreement and an understanding that the bipolar patient is honest with their employer and ask for sometimes accommodations according to the Americans with Disabilities Act to be able to perform the essential functions of that job. And so it's working together. It's a team. It's a partnership. So the treatment. So medication generally used to treat bipolar disorder include mood stabilizers and second generation antipsychotics. Treatment plans may also include medication that targets sleep or anxiety. Healthcare providers often prescribe antidepressant medications to treat depressive episodes of bipolar disorder, combining the antibiotic with a mood stabilizer because antidepressants alone can actually trigger a manic episode. So our mood stabilizers are going to be lithium, which is kind of the go-to. The second one is Depakote, which is the one that I'm on. Tegretol, Lamictal, and Topamax are all mood stabilizers. Antidepressants such as Lamictal, Seroquel, Zyprexa, and Simbax can be quite effective. So our antipsychotics such as Zyprexa, Seroquel, Risperdal, Abilify, Geodon, and Clozapam all work fine to help as well. Psychotherapy, also called talk therapy, can be an effective part of the treatment plan for people with bipolar disorder. And I talk about how psychotherapy actually helped me quite a bit in my other presentation about mental health. All right. Psychotherapy is a term or a variety of treatment techniques that aim to help a person identify and change troubling emotions, thoughts, and behaviors. It can provide support, education, and guidance to people with bipolar disorder and their families. Treatment may include therapies such as cognitive behavioral therapy, also known as CBT, and psychoeducation, which are used to treat a variety of conditions. So a lot of people at work may see me put my earbuds in, and what I'm listening to is psychotherapy, as I actually listen to quite a bit of stuff. On one of the things that I do is I do a guided meditation, which helps to try to calm me down when I'm feeling kind of like I'm not doing well. It helps. It really does. It's fantastic treatment. Electroconvulsive therapy, ECT, which I had done back in 2016 and 17. ECT is a brain stimulation procedure that can help people get relief from severe symptoms of bipolar disorder. With modern ECT, a person usually goes through a series of treatment sessions over several weeks. ECT is delivered under general anesthesia and is considered safe. It can be effective in treating severe depressive and manic episodes, which occur most often when medication and psychotherapy are not effective or are not safe for a particular patient. ECT can also be effective when a rapid response is needed, as in the case of suicide risk or catatonia. So it's not like what you see in the movies and everything. They do put you to sleep. It's not painful at all. All right, so TMS, which is transcranial magnetic stimulation. TMS is a newer approach to brain stimulation. It uses magnetic waves. It is delivered to an awake patient most days for a month. Research shows that TMS is helpful for many people with various subtypes of depression, but its role in the treatment of bipolar is still under study, but they are trying to use it a little more and seeing if it's going to be beneficial to those patients. So now I want to talk to you about what it's like living day to day with bipolar disorder, not only from my own perspective, but also what it's done to my family and job and all the other stuff. First and foremost is these episodes don't happen every day. They come and go, and there's triggers that happen and everything. But what is really bad about it, and I've actually heard people say this, is I don't know which you I'm going to get today. Am I going to get happy Chris? Am I going to get sad Chris? Am I going to get bitter, and pissed off Chris? And I can definitely understand where people are coming from and why they're, it's hard to live with. And as difficult it is for those people, it's very difficult for me too. It's because I don't want to live like that. I don't want to have no control of my emotions in that way. I don't want to feel this way. And it's not fun. Whether it's not fun to be on the manic side, and it's certainly not fun to be on the depressive side, and it affects my day-to-day life in every way. And so the best thing that I can do to live with bipolar is to make sure that I take my medication, to make sure that I'm using my psychotherapy techniques, is to make sure that I'm doing the best job, but that's not always effective. And it has affected me in lots of ways. I've lost jobs because of it. I've broken relationships. I've absolutely, got divorced because of it. And so it's tough. It's very tough. But here's the thing. It's just like with any disease. It's learning how to cope with it, how to deal with it, and how to manage it. And it's the same thing as what I have to do now is I can absolutely, and every bipolar patient can have a life, and they can have a good life if they help to manage that and they find a good support team to help manage that. So let's take a look at how we can manage that. So, how to help someone with bipolar disorder. And one of the big things is understanding and education, understanding the triggers, learning what to do when things don't go wrong, understanding what to do if the person is in crisis, if they're, having thoughts of suicide, if they're creating a plan, if they're doing self harm, and putting some blocks and some plans in place to prevent that person from having difficult episodes. That maybe, if your husband and wife or whatever is one person controlling the money and everything, is to help out. Is if if you're going to be very impulsive in that area, there's all kinds of ways to help someone with bipolar disorder. The main thing is to learn to have empathy, have some understanding, and definitely some patience, because man, being with somebody who's moody in the first place, but definitely with somebody with a severe mood disorder like bipolar disorder, it can be challenging. But it's a challenge that we can rise to and that we can face, and we can work together and help with head on. I'm going to give you some great stuff here in a second. So EMS and the bipolar patient. And one of the things I want folks to talk about is a patient suffering from bipolar disorder is more likely to reach out for help during a depressive episode rather than a manic episode. Empathy, understanding, and a genuine desire to help is essential. Now, we do have to run on these patients sometimes is when they're in psychosis, is when they're having those events and everything, and they may require some additional help, but we always, always, always rule out all the medical conditions first before going straight to that. And so we're really going to be talking here in a second about some things, some myths about bipolar disorder. Always rule out those medical complaints first. So let's talk about ending some stigmas. There's 10 myths that I want to rule out really quickly about bipolar disorder, and I hope it'll help you guys out as well. Myth number one, bipolar disorder is rare. Not by a long shot. According to the International Bipolar Foundation, 2.6% of Americans deal with bipolar disorder in a given year. That's more than 1 in every 40 people. Myth number two, bipolar disorder can't be treated. Now, there's no cure, but that doesn't mean there's no hope. Bipolar disorder is treatable. The International Bipolar Foundation says people with bipolar disorder can lead healthy and productive lives when the illness is effectively treated. In most cases, proper treatment can help reduce the frequency and severity of episodes and can help people with bipolar disorder maintain a good quality of life. Myth number three, medication will fix it all. Nope. Bipolar disorder is a long-term condition that can't be cured or fixed by drugs. While medication does help, it does help to stabilize moods and manage symptoms, it doesn't take away all signs of the condition. A holistic treatment plan includes medication, but also a strong personal support community, therapy, and other mental health services. It's a combined effort of things to try to help you. cope with the disease. Myth number 4, people who deal with bipolar disorder, they're just moody. Nope. Unlike the mood swings that many people experience when they're hungry or tired, the highs and lows of bipolar disorder can last weeks or months. In addition, individuals managing bipolar disorder experience mood changes that are much more severe than those experienced by most people. For example, states of mania can include feelings of invincibility, impulsivity, rapid speech, racing thoughts, and a decreased need for sleep. Myth number 5, and this is one of my favorite ones. Everyone who deals with bipolar disorder is violent. Not true at all. Those who struggle with bipolar disorder, like those with any serious mental health condition, are more, and I want you to really understand this, are more likely to be victims of violence than perpetrators. However, when the illness is untreated, aggressive behavior is possible, and it's possible with anybody. Treatment greatly reduces the likelihood of violence, so a good treatment plan helps. Myth number 6, those dealing with bipolar disorder can't be good spouses, parents, or friends. I struggle with this one myself because a lot of times I'm down on myself and think that nobody's going to love me. I'm not good for anybody, and it's difficult. Relationships can be difficult for those struggling with bipolar disorder and those who love them. But all relationships have their challenges, and the hurdles faced by those dealing with bipolar can be overcome. With treatment and the patience of family members, many people with this disorder are loving spouses, caring and competent parents, and loyal friends. It's just having that understanding and patience and everything. One of my best friends in the world was married for a long time. Her husband was fantastic. He passed away not too long ago, and they were perfect for each other. She was type 1 bipolar, but he knew how to manage it, understood it, and they got along great, and it was wonderful. Myth number 7, mania is the good part of bipolar disorder. Not at all. Many people with bipolar disorder view mania as a desired state of high productivity or a happy break of depressive symptoms. While mania can involve positive feelings and enhanced creativity, prolonged episodes can be just as disruptive to a person's life as a depressive episode. They can involve extreme anxiety, feeling out of control, anger, and risky behavior. And just like if you go out on a bender of drinking or whatever, and after it's over with, you wonder what happened and kind of feel, real bad. That's how I feel after coming off of a manic episode, as I'm like completely just exhausted. And afterwards, I feel like, wow, this was really terrible. And it's not good. Either one of these episodes are not good. Myth number 8, changes in mood happen for no reason. In most cases, changes in mood are triggered, they're not random. Stress, a change in season, holiday, and family gatherings are common triggers, but also illnesses. Learning to recognize the triggers and having a plan for dealing with them can lessen their impact. Myth number 9, bipolar disorder always looks the same. Nope, nope, nope. There are several types of bipolar disorder, and each person who lives with this condition experiences it differently. Some primarily deal with depression, while others have more frequent and severe manic episodes. While the behaviors associated with mania and with depression fall into general categories, each person is affected in individual ways. Myth number 10, people managing bipolar disorder can't be successful. A host of successful people have proven that it's possible to do fantastic, wonderful things while dealing with bipolar disorder. Media mogul Ted Turner, singer Demi Lovato, and actress Patty Duke, Catherine Zeta-Jones, and my favorite princess, Disney princess out there, Carrie Fisher, are just a few examples of the many people with a bipolar diagnosis who've succeeded in their careers, including this guy. Is managing the disorder and having people that understand can help to not only for these people who can be fantastic for your organization, fantastic for your life, is helping them to be able to manage their disease and to be able to have patience and understanding as they can be successful and really add value to our culture and to our life, is understanding that bipolar disorder can be managed. All right, folks. So this is kind of the end of our Easy EMT tonight about bipolar disorder. Next week, we'll be looking at anxiety disorder as well. I want everybody to know is that just because you have a mental illness doesn't mean that you can't do great things. And what I want to do on the other side of things is if you people with a mental illness can do great things for society, for your organization, within family groups and everything, if there's understanding and also if that patient is managing their illness the way they need to. And it's all about working together. Together, we can do great things. Thanks so much for listening. This is Christopher, the Easy EMT, signing off.